Hello everyone. Today I'm gonna talk about anaphylaxis. So firstly, what do you imagine when you hear allergy? You might imagine hay fever or a simple itchy rash. However, anaphylaxis is on a completely different level. It is essentially an allergic reaction out of control. Unlike a local reaction, anaphylaxis is defined by three key features. First, systemic. It involves multiple organ systems, not just one. Second, rapid onset. It happens within minutes to hours after exposure. Third, life-threatening. Without immediate treatment, it can be fatal. So, please remember, anaphylaxis is a systemic, immediate, and life-threatening hypersensitivity reaction. Now, let's look at the mechanism. Why does this happen? To understand the mechanism, let's meet the three key players. First, the mast cell. This is a bomb, filled with histamine and ready to explode. Second, the IgE antibody. This acts as a sensor waiting for the trigger. Third, the allergen. This is a trigger, such as peanuts or bee venom. Anaphylaxis involves a two-step process. The first step is sensitization. Interestingly, no symptoms occur during this first exposure. When an allergen enters the body, the dendritic cell presents the allergen to a naive T cell. Then, this naive T cell transforms into a Th2 cell. The Th2 cell gives a specific order to the B cell. This order is sent via a cytokine called IL-4 and a signal called CD40. Receiving this signal, the B cell undergoes class switching. Instead of making normal IgM antibodies, it starts mass producing IgE antibodies. These IgE antibodies then attach to the surface of mast cell. At this point, the time bomb is set. This is sensitization. In short, sensitization is a preparation phase. Crucially, no symptoms occur during this first exposure. Now, the mast cell is armed and ready. The trap is set for the next time. Next comes the second step, the reaction. When the allergen enters the body a second time, it binds to the IgE on the mast cell. Specifically, the allergen bridges two IgE molecules. We call this cross-linking. This acts as a trigger. The mast cell instantly activates and undergoes degranulation. It releases massive amounts of chemical mediators, such as histamine, in the bloodstream. This sudden release of histamine causes the dramatic symptoms within patients. Now, let's turn the topic to the symptoms. Histamine travels through the blood and attacks four main systems. First one is skin. This is the most common. We see hives, redness, and swelling. Second, respiratory. The airways constrict, causing wheezing and difficulty breathing. Third, gastrointestinal. Patients express vomiting and abdominal pain. Fourth, cardiovascular. This is the most dangerous. Blood vessels dilate rapidly, leading to severe hypotension. When blood pressure drops and consciousness is lost, we call this anaphylactic shock. Here is a picture of symptoms. You can see a lot of redness on skin. In summary, anaphylaxis is a severe reaction driven by Th2 cell and IL-4. Through class switching, IgE is produced which triggers mast cell degranulation. This leads to a systemic crisis involving the skin, lungs, and heart. It is a medical emergency that requires immediate recognition and treatment.